New details on Obamacare. Folks who will have to buy health insurance through the new exchanges are getting an idea of how much it could cost. Individuals should be able to start signing up October 1st. Earlier today, President Obama talking up the plan, saying folks in most of the country may be surprised by what they find when they do some research.
Premiums are going to be different in different parts of the country depending on how much coverage you buy, but 95% of uninsured Americans will see their premiums cost less than was expected. And many families, including more than 2/3 of all young adults who buy health care through these online marketplaces, are also going to be eligible for tax credits that bring the cost down even further.
But Chief National Correspondent Jim Engel is finding a far different story. He's in Washington with the facts now. Hi, Jim.
Hello, Shannon. Well, you know, premiums are only a small piece of this puzzle. The administration offered the most detailed information so far about Obamacare this week, insisting it will do what the president just pledged. Listen.
The Affordable Care Act will deliver on its promise to make health insurance more affordable and accessible for Americans.
Unfortunately, you can go all through that HHS report and not be able to answer the most important question. Will my insurance rates go up in 2014?
They cherry-picked the data in order to highlight the fact that people of low income will benefit under the law, but people of middle income will not, and they didn't really talk about that.
Now, the new law requires the addition of what it calls essential benefits, a long list of things that must be covered. The Manhattan Institute analyzed rates around the country and found that for people of medium income, costs will soar, up by as much as 99% for men and about 55% for women. Listen.
Even if the average American gets some subsidy, a partial subsidy, that partial subsidy won't be enough to overcome the dramatic increase in the cost of insurance, the underlying cost of health insurance that Obamacare imposes on the market.
Now, the plan will clearly help the very poor, but one of the factors the administration does not talk about is deductibles and co-pays, which will substantially drive up the cost for all but the poorest, even those in the cheapest of offerings, what is known as the Bronze Plan.
If you're in a bronze plan, the premiums are going to be relatively low. You know, as HHS said, in some cases people won't pay premiums at all, but there are going to be very high out-of-pocket costs, and deductibles in some cases are going to be over $5,500.
So a person with a plan at that level might only pay $100 a month in premiums, as the administration has boasted, but the deductible will add almost $500 more a month, and that doesn't even count the copay, Shannon. So a lot of the facts have yet to come out on how much this is going to cost the individual.
Well, we had to pass it to find out what was in it, Jim. Thank you.
You're welcome.